So if somebody has Botox who's never had that before, do they see results immediately?
You start to see results in about 3 days. You know, the wrinkles start to lessen, and the muscles that you're specifically targeting in the forehead are starting to weaken at that point. But by about 7 to 10 days, the maximum effect is seen. If we have a patient come in for the first time to have Botox, I usually tell them to come back in 2 weeks, just so I can check their status, you know, relative to their baseline, and to make sure that they're happy with the treatment.
Sure.
Because very often I may have to add a unit or two just to enhance the results. But I try to start conservatively, and then once we figure out a dose that works right for the individual, we document it each time they come in for a treatment, and we stick to that as long as they're happy.
So it's very specific to each patient.
It is. So, well, some patients come in with asymmetries. One eyebrow is higher than the other, and you can actually correct for that to some degree by giving Botox asymmetrically, a little bit more on the lower side, a little bit less on the higher side. So once we fine-tune the treatment, we keep a careful record, and we tend to keep patients pretty happy.
That's great. I had a friend of mine ask me what happens with Botox or any of the injectable substances. Does your body just naturally absorb them?
Botox is just degraded.
Okay.
Yeah, it's just degraded over time, and its effect starts to diminish at about 3 months.
Okay.
Yeah, so that just goes away. And Botox is an interesting substance because it's been around. That toxin's been around for a long time. I mean,
yeah.
It's the same toxin that can contaminate improperly handled meat products. It's a toxin that's produced by a bacteria. So if you were to ingest the toxin, with tainted meat, for example, then you could become very sick and die. So why one doesn't become sick with Botox injections is because you're not ingesting it, and it's not intended to go in the bloodstream. And it's also low dose.
Yeah.
So it's a toxin, but it's controlled, and it acts only locally. Generally speaking, it acts locally where you inject it.
Great. So how is that different than Restylane? Are they just two different products? The Botox or the neurotoxins alleviate wrinkles by weakening the muscles that contract and cause the lines between the brows and the corners of the eye, for example. Whereas the dermal fillers, Restylane is one, Juvederm, Radiesse, they're bulking agents. And so their effect is to remove or soften a wrinkle by adding volume to the area to sort of make the wrinkle less prominent and fill it out, so to speak. So they're not toxins. They don't weaken anything. They're just bulking agents. But they achieve essentially the same end as Botox by wrinkle reduction. Smoothing, although we use the fillers, the dermal fillers, more for static wrinkles, those that are just there all the time, whether we animate or not. And Botox in general is used to treat more dynamic lines, those that come from muscle movement, typically. Okay. So those are the two popular ones, Botox, Restylane, and are there other dermal fillers that are used?
Juvederm is sort of like the new Restylane. Basically, Juvederm and Restylane are both hyaluronic acid products, and these are molecules that exist in all mammalian skin, and we tend to lose this hyaluronic acid as we age, which is why our skin becomes more deflated and wrinkly in appearance. So the two biggest dermal fillers that we utilize are Restylane and Juvederm. But there are other fillers. There's Radiesse, which is calcium hydroxyapatite, which is basically a consistency of a gel, and it's made of minerals such as those that you find in teeth and bones. And its duration may be a little bit longer lasting, and it's meant for deeper injections. You can put the hyaluronic acid products like Juvederm a little bit more superficially, whereas with Radiesse, you want to have it a little bit deeper typically so that you don't see it or feel it. And then there are volumizing agents like Sculptra, which is another product that we use frequently. That's an agent that we use to fill out entire regions of the face. Hollow regions. Sculptra acts very differently than all the other agents because the primary mechanism of action of Sculptra is to cause your body to deposit collagen. The product itself disappears in about 6 months, but your body deposits collagen in response to its presence. And you have to repeat Sculptra multiple times in order to get to the final endpoint. Whereas with Juvederm or Restylane, you put the product in the line, and at time 0, it's corrected. But the reason why you have a correction is because the product is there. Not so much that your body deposits collagen. I mean, there may be some collagen deposition. Radius claims that, for example, but Sculptra is a product that's all about collagen deposition. That's primarily how it works. But the effect is delayed. So if you're coming in for a line, for example, you want a single line filled, or these creases here, we typically fill those with Juvederm or Restylane because the effect is immediate, lasts about 6 to 9 months, and then you have to come in for a retreatment. Whereas people that have significant weight loss or hollowness in their face or temples, then they need volumizing. Sculptra is a good product for that, but it takes months to get to the endpoint that you want.
Sure. And then once you get to the endpoint with those products, there's like a maintenance schedule.
There is a maintenance schedule. You have to repeat them.
All good things need to be maintained. That's right. Eyelid surgery is something that when I was reading up about this as some of the procedures, that seems to be a more popular one with a little bit older end of the spectrum.
It's very true. It's one of our commonest procedures that we perform for facial rejuvenation. What's nice about eyelid procedures is that we can enhance those results with non-invasive techniques like using Botox. A lot of times patients will come in and they'll be unhappy with the appearance of their upper eyelids. But usually it's a combined problem. It's not only excess skin in the upper lids, but the brow is a bit low. Brow is descended as well, and so that imparts a heaviness to the upper eyelid region. So you have to figure out when you're evaluating patients how much is due to the brow descent and how much is due to the eyelid skin excess. And so what I usually do is chemically treat the brow with Botox about 2 weeks before the eyelid procedure, just to stabilize the brow position. And then at that point, I can accurately assess how much eyelid skin we would need to remove. In the past, I would do an endoscopic brow lift and an eyelid procedure together, which can still be done, but I'm finding that patients can do really well with less surgery these days. Chemically lift the brow with Botox, do upper eyelids, the recovery is very quick, and it gives very, very nice results. But you have to maintain the Botox. But what I used to tell my brow lift patients was that those patients who had brow lifts wouldn't have permanent results either from that. In order to maintain the surgical brow lift, we always recommended Botox. Because the muscles that we're targeting with Botox, it's not only efface the wrinkles that are a problem for patients, but also weaken the muscles that tend to naturally want to pull the brow down. So if you keep those muscles weak, then your brow will stay elevated in a more natural position for longer, and it will enhance your surgical results of a brow lift.
Wow. Who knew?
There's a lot.
There is a lot. There is a lot. I have a couple of questions. Alice writes in, how much do fillers cost, and are they ever covered by insurance?
Well, generally speaking, fillers are cosmetic. Strictly speaking about Juvederm and Restylane. The cost is roughly $650 per syringe, but if we have to use more than one syringe, a lot of times we'll discount the second syringe. So depending on how deep the lines are and whether you need 1 or 2 syringes, it could be anywhere from $600 to $1,000. Now Botox sometimes is covered by insurance, but as in a plastic surgical practice such as ours, we don't use Botox for insurance indications. I mean, it's definitely indicated for migraine headaches. And if you're specifically needing treatment for migraines, then a neurologist could do those treatments, but it would involve multiple injections in the scalp and in those areas.
I see.
So in using a Botox for migraine treatments, it can be covered by insurance, but we don't do that type of treatment.
But I did notice on your website that you have some financing and payment plan type of situation. So
Sure, there's care credit.
Yeah, if that's holding anybody back, that's doesn't have to. What is the recovery time, Bren writes in, for a facelift?
Well, I guess it depends on the endpoint that you're speaking about. I tell most patients that, depending on how involved the procedure is, you need really a good 2 weeks out of the public eye. And by about 2 weeks, most of the bruising and swelling is dissipated, all of the sutures are out, and you can wear makeup and you're pretty presentable to go in public. As far as full activity and exercise, 4 weeks would be more realistic, because you really don't want to getting your blood pressure and your heart rate up too early. It just makes the swelling last longer. So it's not as long a recovery as one would think.
Yeah, absolutely.